Κύριε Πρόεδρε και μέλη του Εκτελεστικού Συμβουλίου του Φόρουμ των Δελφών, distinguished guests, κυρίες και κύριοι, ladies and gentlemen. Since the outbreak of the pandemic, it was clear that the way forward towards healthier, more equal, and more resilient societies are that of solidarity, coordination, and collaboration. As in any crisis, COVID-19 highlights the fault lines in our societies and our health systems. It amplifies inequalities and targets vulnerable groups. It shows the gaps. The pandemic, the COVID-19 virus, thrives on what makes us human, our desire for social contact and communication. But the solutions to this crisis also lie in the same essence of humanity, in social collaboration, in solidarity, and in learning from shared history. I am delighted to join the Delphi Economic Forum, which this year also commemorates the Greek bicentennial and gathers exactly the kind of multidisciplinary expertise we need in order to recover, to build healthier, more resilient, and more equal societies. Viruses are inseparable from the history of humanity, something that Greece knows very well. Indeed, it was not too far from Delphi that Apollo rained arrows representing the plague on the Greeks in the Iliad. Viruses throughout history, despite being 1,000 times smaller than a grain of sand, have caused untold suffering. But they have also shaped human organizational structures, and they've shown societies where they need to improve. In a very evolutionary sense, viruses and pandemics are drivers on how societies can and should recognize to become more resilient towards such threats. 2,500 years ago, Thukydides pointed out that overcrowding, inadequate housing, and sanitation helped the Great Plague of Athens to spread rapidly. So we learned that action on pandemics needed to address social factors such as hygiene and prevention. In the 19th century, these lessons were echoed by French and German physicians who added science, data collection, and epidemiology to the three ancient pillars. And even more recently, the HIV/AIDS epidemic taught us about the importance of global solidarity, of inclusivity, of equality, and innovation. History teaches us that out of crisis also come opportunities, that we need to holistically address the weak points in our health systems and in our preparedness and response capacities, and recognize that in a pandemic, no one is safe unless everyone is safe. This phrase is becoming a cliché, but it couldn't be more true. We will not be safe until the virus is controlled in every corner of the globe. It is precisely in this vein that we, in the European Union, are taking decisive and coordinated action, not only to exit the pandemic, but also to build stronger, more resilient health systems and to improve our preparedness and response capacities for the future. Our EU vaccine strategy is a powerful example of European collaboration and solidarity in action. Through this strategy, we have secured a broad portfolio of almost 2.6 billion vaccine doses for European citizens, our neighbors, and third countries. More than 208 million doses have been delivered to member states, and vaccination campaigns are picking up pace across the European Union. Much as it has been criticized, it was this common European action that has now ensured that over 34% of our adult population have already received their first shot. That Europe is the beating heart of global solidarity, with around 200 million doses exported to the rest of the world, almost as many as delivered to our own citizens. History will be the judge of this historic step, but I will dare say that none of us would want to think of how Europe would be in the eyes of citizens if not all member states had access to vaccine at the same time. How the Union would have stood if those smaller or medium-sized member states, like Greece, did not have vaccines for months after citizens were vaccinated in bigger member states. For us, it is essential to continue undeterred on this course. And that is why we're now looking at our strategy for the coming years, with a contract soon to be signed with BioNTech Pfizer for the purchase of 1.8 billion doses. Last Thursday, we launched a highly significant strategy on COVID-19 therapeutics, another crucial part of the puzzle of the fight against the pandemic. Again, a strategy based on the same principles of equity, solidarity, and access, as is our EU vaccine strategy. We now know that even with widely available vaccines, we will still have COVID among us. We will still treat patients. We need, therefore, to support the development and availability of much-needed therapeutics, including for the treatment of long COVID. And we are confident that by the end of this year, we'll make available at least 3 safe and effective therapeutics for all our citizens. The pandemic has led us to reevaluate our existing framework for actions in the area of health at the EU level. We need to be honest that no one was prepared for this unprecedented global health crisis. We need now, moving forward, to put long-term solutions in place. We managed to be flexible, to find solutions, to work in solidarity with countless examples of this throughout the last year, with joint procurements for medicines, with cross-border care, with sharing of best practices and expertise, and so much more. But we need to put long-term structural solutions in place. Our proposals for a European Health Union are precisely this. They are a package of measures which will give us more comprehensive tools for preparedness, surveillance, risk assessment, and early warning and response. With this package, we are changing the way we address serious cross-border threats to health, providing stronger legislation tracked together and not fragmented in national silos. We are making sure that the 2 EU agencies that have been at the forefront of our work, ECDC and EMA, have the capacity and the mandate they need for today's world and for the future. And alongside this, we want to establish a new Health Emergency Preparedness and Response Authority, HERA, which should be operational by 2023. HERA will be another cornerstone of the European Health Union, anticipating serious cross-border threats, identifying effective responses so we can react quickly to future health emergencies. Ladies and gentlemen, building a healthier and more resilient and more equal European Union is a complex puzzle with many pieces, which we are determined to put together. Europe's Beating Cancer Plan represents a new approach in cancer prevention, treatment and care, and this plan will be a game changer to help the European Union lead the world in the fight against cancer. I'm very glad that I will be able to elaborate more on this important plan later today. The new pharmaceutical strategy for Europe will ensure patients have access to innovative, affordable medicines, while supporting competitiveness, innovative capacity and sustainability of the EU's pharmaceutical industry. And our new EU for Health programme, amounting to €5.1 billion, sends a very clear message that public health is a priority for the European Union. Never before has there been such a significant standalone health programme. These are monumental strides for EU health policy, which only 2 years ago would have been unthinkable. COVID-19 has turned our world upside down, but it has also highlighted what we need to strengthen. It has made us look at the bigger picture, how we live, how we cooperate, how we interact with the world around us, that we must put long-term sustainable solutions in place. Building a robust European Health Union is a significant step in this direction. And another key important part of this puzzle is our Farm to Fork strategy, part of the European Green Deal, to build a fair, healthy, and environmentally friendly food system. Here, as in the area of health security, change is a matter of survival, planetary and human survival. We are battling a respiratory virus on a planet that struggles to breathe at a time when scientists are calling this the era of pandemics. That is where we have a choice. to see human, animal, and plant health as planetary health as one continuum. Only when we treat them as such and address them as such through concrete action, we'll be able to put societies on a. This is not an issue which is either national nor European. It concerns every single one of us on this planet. Ladies and gentlemen, we need to look around us with hope. But more than that, we need to look around us with ambition. Citizens rightfully expect this from us. It is a time for responsibility and for action. We cannot fail them. I would like to thank you for your attention, and I wish you a very productive Delphi Forum week. Thank you.